everyone. Good morning and good afternoon. Let's give a little bit more time for people to join. I don't know if others are like me, they don't, you don't necessarily register before, so that adds a couple of minutes to join. And hi, Khalid, nice to see you online.
Hello, Astrid. Hello, everyone.
Okay. So let's briefly start. First of all, I'm your chair today because Jennifer is at Wilton Park, where there's a big meeting in the UK about PSEA, and she's there to talk about, the linkages with GBV and GBV services and risk assessment, etc., within PSEA. So that's why she's not leading the call. She's also just come back from a mission to Sudan, which we will include in the next monthly meeting, a briefing on that. That was a mission together with the Global Protection Coordinator and the Child Protection Global Coordinator. We do have a travel ban in that it's very, very restricted to get travel approved after the defunding, but these two missions, also the Wilton Park, were seen as important also for in terms of the advocacy and acting within the space we're in now with all the reforms and all the changes coming. I'm really happy to see so many of you online. It would be great if you do like Akiko and Naima as well and introduce yourself in the chat. We have potentially an hour and a half, but if we finish after an hour, we will finish after an hour and you'll have a break between your meetings. We're going to first talk about, try to update you on some other reforms that are happening. There's a lot of changes that have come after since the beginning of the year, starting with the defunding and the launch of the Humanitarian Reset. And then we will have Faiza Husainy from IRC presenting their report on contextualizing GBV prevention and response, rhetoric or reality for WROs and WLOs in humanitarian context. Of course, in all the reforms and all the discussions, we will also be coming back to the role of local actors. And then the last agenda item before AOB, in case there's something else you'd like to raise, there's the Bidita, our GBV AoR IM in Ukraine, working with Akiko, who will present the Voices report from Ukraine. So the latest assessment with focus group discussions on what's happening in Ukraine. I just saw the translation. It's good. Okay. With that, I guess we just go into the reforms. Shiva, do you want to put up that one slide? Okay. So since last time, we also had our core member meeting where we also presented on the reforms. I'm going to try to be quite brief, and then Stephanie and Christine will also come in. And then I'll try to be brief so that you can also, in case you have questions. So where we are now in this long line of timelines, we're advocating for the prioritization of GBV within future coordination, future humanitarian structures. We're not, to be very honest, advocating specifically for the AoR, or is that, what will be the form, but we're trying to be open and really look at how, in whatever is coming, can we make sure that GBV is prioritized, that the rights of women and girls are being met, that local actors have a bigger part, and also that there's a predictability and an accountability, something we've been working on over the last years to really clarify. And I think that's maybe the advantage that the clusters have had. But we also recognize the structures we are in are heavy and bureaucratic. So just to take a step back, there was the USD funding, and we had a discussion on the monthly call where we presented the impact on country partners, local national organizations, as well as NGOs and the UN. And I think everyone has been reading the news, and we know that more or less every agency, every organization is really impacted. And of course, the big worry is at the country level, more than anything else. Then we went through the prioritization where I think in hindsight, we had that on one of the calls. In hindsight, it's clear that GBV and other areas of protection were prioritized within the HNRPs in that revision of where, with much less funding, where should the priority be? And then at the same time, so this started with the 10th of March deadline, HCs were also asked to look into gains in terms of coordination structure. So what's clear is that the HCs are getting a much stronger role in helping determine or deciding on coordination structures. Then came the letter from the ERC to the principals with the humanitarian reset. And right now there are 4 working groups under OPAC, whatever. There are 4 working groups at the global level. And they are composed of the cluster lead agencies as well as the coordinators and the coordination teams. There's the IASC members, so there are also some NGOs, and there's been efforts to bring in more of the local voices as well. Maybe not enough, but there has been. The 4 groups are looking at kind of HPC, lightning, or how to be more operational. There's a group on localization, being more people-centered. There's a group on restructuring, or actually what is good practice that we can build on in terms of merging or consolidating coordination. And then the last group is on transitioning. How can we be more time-bound? How can we, focus in on the crisis and then hand over or deactivate more quickly? All of those groups are working to finalize recommendations this week. The principals or the deputy principals have also finalized a set of recommendations that I have to admit I haven't seen, but build around the same areas around financing, how to be more operational, how to be more streamlined, etc. They finalized, and then in June there will be recommendations or report or decisions from UNICEF and Save the Children as the co-chairs of that work on the future of clusters. It does seem like in the 4 groups where Jennifer is in one group put together with Stephanie, I've been in one group, and then UNFPA is in 2 other groups we're trying to share. In those groups, the discussions are still kind of focusing on how to improve or change clusters. It hasn't been a discussion of completely tabula rasa. I don't know, maybe that's a lost opportunity. Maybe that will come in from other channels. We don't know what's coming, basically. Also in June, in addition to the recommendations on the clusters, there's the UN at 80. And as part of the UN at 80, there are discussions around mandates, or let's put it like this, that the mandates or the UN mandates will remain, but who is implementing and how they're implementing is being discussed. So there is also discussions around merging of UN agencies, and looking at kind of, there are also discussions. I don't know if that's within the IASC or within the UN80. There are also discussions around review of who are cluster lead agencies, who are provider of last resort, how those lead agency functions sit in terms of specialization. So I'm sorry, I realize I've already talked quite a lot. I'm going to hand over to Stephanie and then to Christine afterwards. Stephanie?
Yes, thanks, Astrid. So I'm just going to update on findings from a focus group discussion, which we conducted with women-led organizations across 5 contexts, around 10, 11 participants, I think. We had participants from Colombia, DRC, Mali, Yemen, and South Sudan. And the discussion focused on the humanitarian reset process, as Astrid described, to sort of make sure that we can also gather their inputs along with the survey, which Christine will update on afterwards. We explored in the discussion WLO perspectives on the current cluster structure, localization and coordination, community-led responses, and also left space for them to really share what were their thoughts and ideas for at this critical point of rethinking the system. It was a rich discussion, and we had a number of common recommendations across contexts, but there were also some points where participants quite differed in what was working for their countries and where they called for context-specific flexibility. I'll just go through kind of the key themes. First, on balancing power and community leadership. Participants emphasized that WLOs must be recognized as equal partners, not as often as happening just as implementers. What was specifically emphasized was the co-creation of solutions, which should center their local knowledge, agility, and the trust they've built with communities. Many also highlighted that their responses are often more effective than the top-down approaches because of their adaptability and their contextual grounding. Secondly, we discussed the urgent need for long-term flexible funding. Of course, we discussed how the abrupt donor cuts have had devastating impacts at the community level, specifically related to women-led organizations and also specifically within the response to gender-based violence. In the discussion, they did emphasize the need for dedicated and predictable funding to maintain both the service continuity, but also the relationships with the affected populations, because they do have this trust of continuity of services, which then is currently really at risk. A third point was on leadership and participation in coordination spaces. They emphasized that being physically present in coordination spaces significantly increases the visibility of GBV and women's needs. Yet, women-led organizations continue to face structural barriers, exclusion from high-level meetings, language barriers, but also, and that was discussed a bit more at length, the lack of financial support for coordination roles. So, for example, in DRC, where women-led organizations do at several subnational levels hold the co-coordination roles, they aren't covered financially for it. So the co-lead roles are unfunded, unlike the lead agency positions, and this disparity further undermines the local leadership and equality in partnership. We discussed preserving GBV prioritization. Women-led organizations expressed concern that GBV is often the first to be deprioritized or defunded during reprioritization exercises. Participants strongly opposed merging the GBV AoR into broader protection structures, warning that it would dilute focus and weaken advocacy. Maintaining GBV as a standalone AoR was considered critical to ensure continued attention and also accountability. Finally, we discussed views on national versus subnational coordination. So these were a bit the parts where opinions varied. In some contexts, subnational coordination was seen as more effective and closer to the response. And it was suggested that savings could be made by deprioritizing the national level and focusing on the subnational, where coordinators are closer to the response, closer to the community. And that it would be, yes, possible to make funding cuts by maybe streamlining further the coordination at the national level, whereas in other contexts it was maintained that national level roles remain critical due to security constraints and other realities of the context. So they called for flexibility and not a one-size-fits-all approach. I think several of these recommendations were also mirrored in the wider survey, which we're now going to hear more about by Christine, who's done sort of the analysis, also looking at the subset of survey respondents that were women-led organizations. Over to you, Christine.
Thank you, Stephanie. So good morning, good afternoon, everyone. So as earlier mentioned by Astrid, one of the groups which focuses on localization and people-centered approach, they launched a survey to gather inputs from local and national actors. And this survey was open for about 10 days. It was closed yesterday. So what I'm presenting today is actually the preliminary results. The final results are currently being analyzed. So just to give you an idea, the preliminary results had a total of about 800 responses. And out of those 800 responses, we had 261 women-led organizations that responded. And it was the highest percentage of local and national actors who responded to the survey. So that was a very good thumbs up for the reach that the GBV AoR has in terms of getting feedback from women-led organizations. So after that, we tried to break down the responses by region, and where we had the most responses was from West and Central Africa, followed by Southern and Eastern Africa, and then Asia Pacific. For Europe, for the preliminary results, this is only Ukraine. I think in the final results, we might have Turkey added to that, but for now, Europe is only limited to Ukraine. So when it comes to the top 5 clusters, so one of the questions in the survey was to know in which clusters the women-led organizations are part of. And from the preliminary responses, the highest cluster was protection, followed by GBV, education, health, and then food security and child protection came at a tie for the 5th place. This was quite interesting, as we were kind of expecting that GBV would be the main cluster or AoR, but we are also aware that a lot of these organizations are members of multiple clusters and AoRs at the same time, and depending on the structure within the country, this is the results that we got. So the survey actually had three main questions, quantitative, and it had 2 main questions that were qualitative. So for the purpose of this presentation, we'll only focus on the quantitative data, as we're currently going through the qualitative data. So that will be available for the final analysis. So the first question was revolved around what these organizations would think to be the most transformational for the humanitarian system. And here, what we tried to do was that we showed the responses that were ranked according to women-led organizations, and then the overall ranking that is for the total 800 respondents. And for the first question on how you know, from a localization perspective, what would be the most transformational? What came first for women-led organization was to reduce inequalities in partnerships. And that ranked fourth in the overall ranking, as compared to require a local and national actors' leadership in coordination and action, which ranked first for the overall ranking, but third for women-led organizations. But where they were in accordance was that local and national actors should be the primary recipients of country-based pool funding. So this shows that there is quite a difference in what women-led organizations consider to be more impactful with regards to transforming the humanitarian system. So the second question was about the people-centered approach. And here the ranking was pretty much the same for women-led organizations and the general respondents, with local community engagement coming up top, system strengthening, and locally led cash responsive. So it's actually just the last two responses that differed. But in general, the people-centered approach seemed quite the same for all respondents. And last of all, for the last quantitative question, it was to know what would be the best way to gather engagement from the local and national actors. And here, every women-led organizations were quite the same as the overall ranking. They were exactly the same, actually, but it was a bit interesting because the other subcategory that had different perspectives was organizations that are led by people with disabilities. So here, for them, the best feedback on engagement was through through networks of local and national actors, and surveys ranked last because we suspect that there have been so many surveys going out and people are very tired of surveys, and also because of the limited nature of the responses that are offered as options for these surveys, because they're most often you select something that is proposed. So there's this feeling that what they actually want isn't even amongst the responses. So there are a lot of ideas on why they would prefer to have, their networks be the mechanism through which feedback on engagement is provided. So maybe just to, make a connection with what Stephanie was saying previously, there really is a trend in the qualitative data talking about the need to really ensure that there is this engagement from the start by local and national actors, and also that they should be allowed to really put forward their knowledge and their way of responding to crisis, and not really just be implementers of what the current system wants. So those are the preliminary trends from the qualitative data, which go alongside what we had from our focus group discussion. And hopefully after tomorrow's meeting, maybe in the next monthly call, or maybe before that, we'll be able to present the final analysis of this survey. Thank you.
Thank you, Christine. I do think it's interesting that, I mean, the protection cluster, including GBV and child protection, is then 35% approximately, right, of all the WLOs are in protection. I think on its own, that's quite interesting. I don't know if that reflects the membership or if it reflects who wanted to respond. But I wonder what that means in terms of localized coordination for the future. Thanks, Christine. I don't know if there are questions, but there probably are. I realize we're overloading you with information. To be very honest, I think there's a lot of goodwill in trying to bring together all the consultations, but it's very there's a lot of kind of separate, working groups at the same time. The discussions kind of overlap. There's parallel discussions between the higher levels, and it's not it's happening very fast, and it's not all easy to take in terms of where is it that we can have the most impact. I don't know if there are questions. Akiko?
Hi, hello.
Hi,
Hi, Ashley. Thank you for sharing this, and also thank you for sharing the survey. We disseminated, the survey to Ukrainian partners, and I'm sure that, they responded, many of them responded. So I really appreciate the opportunity. Just one question. At global level, are there any initiatives to include, local national partners from any countries, apart from focus group discussion like that, you conducted, or from the survey, including like inviting some of them to their meetings, even virtually, to hear directly from them? I was just concerned that, I mean, a lot of, concerns we hear from partners, I've been briefing the partners on, the development, of, this process that's happening at global level. But a lot of concerns they hear is that, they're, of course, this survey is one of them, but, the opportunities to reflect their voice is extremely limited. So they are really, I see a lot of anxiety there that, what is, being discussed at the global level. That's why I really appreciate that you being, updating us regularly and giving us opportunity to give feedback. But I was just wondering, at global level, how do you see the level of, appetite for engaging more like local partners and, localization, not just being, in the document, but, actually, like have impact, in the new structure? Thank you.
It's a very good question, Akiko. I think, I think when they sent this survey that was emanating from one of the groups on localization, right? They received 800 or something responses within a few days, which really speaks to the need and that it's not sufficient. I know that I can't remember the name now, so I know April is on the call in case you want to come in, April. I know that there is also a specialist working on the HCs, with the HCs and doing consultations as well on how to empower HCs. And I think she also has a group of local actors that she's consulting with regularly. I think what's becoming clear, I can't predict, but from what it seems like in those global discussions is that, and from all the reports and recommendations, is that in the country level responses will not necessarily mirror the global mandates, or you can imagine having a global an agency having the global lead in terms of standard setting and policy and kind of the technical expertise and maybe being provided last resort, but that in the countries, it's the actual coordination mechanism will be defined by the countries. And I hope that there, the local actors will come in to define in their country what they need. But I agree. I mean, that is a big question, and I think it's been raised by several global coordinators as well, including Jennifer. And then at the same time, there's this, we've all known for so long we need to change, and then comes the defunding, and it's so dramatic. And then the processes are going very fast. So I hope, and I don't have the full overview to what extent local actors are involved at the country level. What's also become clear, I think from the discussions, for example, with Gemma in OCHA, is that it's the clusters that have the most local actors and have the most consultations, the most consultative forums in the current structure, more than the HCTs. But yes, I mean, the future of coordination will only work and be simpler, and this exercise will only make a real sense if we're able to really bring it around what local communities want in terms of coordination and what makes sense. There's also been some discussions around, when local actors having to being siloed into or having to attend different coordination structures that are sector specific. There's been some discussions around criteria of overlapping partners being what defines also how coordination is taken forward. But in the group I've been in, it's been very clear that what's is mainly proposed is to bring in area-based or so geographically based multi-sectoral coordination as far as possible, starting at the local admin levels and up to national. But at the national, still having some sector specific. And then from our core members, as well as with partners, we've been trying to think about what is it, if we would want to make sure that women and girls' needs and rights are prioritized, what is the minimum or the core for GBV coordination? And that is really, we need to be able to have a light coordination where at least there's this coordination of service providers, whoever leads it, that there's a coordination of service providers so that we can have the referral pathways as to create the access to services and have a shared pool around learning, and that those referral pathways is also something that we provide for other sectors as well as PSCA networks to access the services. And that's something we do for the survivors, but also for the system in a way. Yeah. I wish I had a better response, Akiko. Any other questions? Sorry, I haven't been able to look in the chat. Okay. So there's a comment from April being on the bus. Yeah, where she's talking about the survey. I think it's the same survey that for which Christine provided some of the preliminary results, and that it's continuously ongoing. What's also clear is that, for example, now there's been a peer-to-peer mission to Afghanistan, where there are recommendations of folding in AoRs or merger. So there will certainly be discussions about that recommendation, but there's the HCs are already in several countries having discussions around the future of coordination. So there's establishing facts on the ground or changes at the same time as there's a lot of policy level debates. Yeah. If there are no questions, I'm going to hand over to Faiza Husainy. Are you online?
Hello.
Hi.
Hi, everyone. Hi, Street. Good morning, good afternoon, depending on where you are. I hope you can hear me properly.
I hear you well.
Okay, great. So thank you so much for the opportunity of presenting IRC policy report. I just want to flag in here that this is a continuation of the previous policy reports that IRC have been produced, and they are available in GBV Responder network, including Why Not Local, Why Wait, and that's a continuation of to see and examine whether humanitarian GBV services are accessible, relevant, and effective for local population. Thank you, Shiva, for supporting in managing the presentation. So the goal of the report is to gain a clear picture of how contextualization practices are implemented and the result they achieve for clients and communities. It also examines how women-led organizations and women rights organizations contextualize global GBV guidelines to meet local needs, cultural norms, legal framework, and geography. Additionally, the report is exploring whether these organizations receive adequate funding for their efforts and whether these available fundings are sufficient to implement these adaptations effectively. Next, the research was conducted in 3 countries, including Democratic Republic of Congo, Guatemala, and Jordan, to capture a regional diversity and examine contextualization efforts across varied geographical, social, and humanitarian settings. So the methodology for this report was including desk reviews, to explore how organizations adopt global guidance to meet local needs, cultural norms, legal framework, and geographical realities in each region. Also, we had key informant interviews with donors, local, national, and international organizations. We also gathered insights from our clients, both survivors and those at risk of GBV, through focus group discussions to assess if clients are supported in a way that's not only culturally sensitive, but also aligned with their needs and fostering a safe environment for them to access care and support. Next, please. So while we are talking about contextualization, what we really mean by that is assessing the extent to which GBV programming components are being implemented according to a GBV minimum standard in a particular context, identifying which key actions for each minimum standards and or additional actions must be prioritized, initiated, adapted, sustained, strengthened, or better coordinated to achieve the minimum standard in a specific context, and understanding the needs of a specific audience and creating content that resonate with them. So for that, we were working on assessing the current practices of GBV programming, contextualization person. The current GBV programming practices vary across region, influenced by local context, cultural norms, and available resources. WLOs and WROs are the forefront of contextualizing global GBV standard for these unique settings, often navigating complex social, economic, and political landscape. Across all assessed contexts, local community engagement has been central to ensuring that GBV programs are accepted and relevant to the people they serve. WLOs and WROs reported that the adaptation of services to meet the needs of marginalized groups, such as indigenous population in Guatemala and refugees in Jordan, remain a top priority. And finally, capacity building for local organization continues to be a significant focus, especially in context of limited funding and operation challenges. Next, for that, evaluating the effectiveness of contextualized GBV program is essential to understand whether They meet clients' needs and address challenges of a specific context. It's also critical to assess not only the impact of the program, but also the relevance of and effectiveness in providing accessible and appropriate support to clients in diverse contexts. This evaluation process often relies on community feedback, pre and post evaluation, and behavior indicators. However, effectiveness is evaluated differently by different stakeholders. For instance, donors often emphasize measurable outputs such as number of survivors served on the availability of services to assess the impact of their funding. However, the reliance on quantitative metrics can be limited understanding of the deeper effect of contextualization effort. Some donors express a desire of qualitative data, including insights into change in community attitudes, survivor empowerment, and shifts in gender norms. Despite this, feedback mechanisms like focus group discussions and community surveys are underutilized for assessing the qualitative impact of GBV programming. INGOs also noted that they use tools like protection analysis, focus group discussions, and surveys to evaluate the contextualized programs. However, they also noted that their evaluations are frequently hindered by short funding cycle, which leave them a little room for long-term impact assessment. For example, in Guatemala, INGOs reported challenges in tracking the long-term effectiveness of culturally adapted material due to lack of dedicated resources for monitoring and evaluation. Also, WLOs and WROs reported a heavy focus on community-driven evaluation, where survivor voices play a critical role in assessing program effectiveness. In DRC, WLOs used survivor feedback to adjust livelihood program and ensure they meet the economic needs of survivors. However, they noted challenges in scaling these evaluation systems due to limited financial resources for sustained data collection. WLOs and WROs report using a number of innovative approaches to contextualize and implement GBV programs. They all bridge the gap between global standard and local realities, ensuring that interventions are effective, sustainable, and survivor-centered. WLOs and WROs prioritize engaging local community to ensure that GBV programs are tailored to the specific needs and realities of people they serve by working with local leaders, community-based organizations, and survivors. They ensure the programs are both culturally driven and widely accepted. Also, it's critical to build the capacity of local actors, ensuring sustainability and local leadership. WLOs and WROs provide training and resources to local organizations, empowering them to manage GBV program independently, reducing reliance on external funding. Also, the program designed with the needs of preferences of the survivors at the center to ensure more effective intervention. WLOs and WROs listen to survivors and incorporate their feedback into program development and providing tailored psychosocial support, legal aid, and economic empowerment. They also leverage technology to reach hard-to-reach communities and expand the service delivery models like mobile platform, telemedicine, and digital outreach have become critical in ensuring that clients are having access to care, especially in areas with limited infrastructures. They also engage in advocacy to influence local and national policies around GBV, ensuring legal frameworks are not only inclusive, but also enforced effectively. They work with governments and international bodies to advocate for the protection of clients and persecution of perpetrators. For example, in Jordan, WLOs advocate for stronger laws around sexual harassment and GBV, pushing for policy reform to provide better protection and support for survivors. Also, collaboration between local and international organizations is vital to sharing the resources, knowledge, and expertise. And WLOs, WROs foster partnerships that enhance the scale and effectiveness of GBV program. Although by having all these approaches, the non-importance of the static prioritization of contextualization for GBV program, FHCC stakeholder identified several restrictions to secure and allocate resources efficiently. And flexibility in donor funding is a recurring issue. For instance, WLOs and WROs in Jordan and DRC shared the donor requirement often focus on a standardized outputs, leaving little room for program adaptation based on real-time community feedback. Funding for GBV program is typically provided on a short-term basis, making it difficult to plan and implement long-term sustainable contextualized solution. WLOs and WRs in DRC highlighted that the pressure to meet short-term goals often divert attention from addressing root causes of GBV through tailored intervention, and also they're rarely receiving core funding, which is essential for building organizational capacity to ensure the sustainability of contextualized program. That we have example in Guatemala that local organizations reported that lack of core funding limits their ability to engage in advocacy and expand their services. Regarding the barriers for the contextualization, what was reported by WROs and WROs were including culture and social barriers, funding resource barriers, logistical and operational barriers, with very detailed examples across all these regional countries that we had conducted research there. At the end, we were able to have and obtain recommendations based on analysis and having some quotes directly from donors, from WLOs representative, and also from clients. Donors should prioritize direct funding to WLOs and WROs, ensuring that they have resources and independently manage and contextualize GBV program. Funding mechanism should also allow for flexibility during the project implementation, enabling local organizations to adapt their programs in response to evolving needs and real-time feedback from communities they serve. There is a need for strengthening coordination among donors, INGOs, WLOs, and WROs in aligning GBV program with local priorities and effectively addressing the needs of survivors. Donors emphasize the importance of fostering collaboration through inclusive coordination mechanisms such as regular cluster meetings or advisory group where local actors have meaningful voice in decision making. One of the donors noted that it's imperative to hold partners accountable for delivering results in collaboration with their local counterparts, ensuring aligning with the local priority. This highlights the needs of INGOs to actively involve WLOs and WROs in planning and implementing GBV intervention rather than treating them as a passing subgrantee. Also, one of the WLOs representatives shared a concern during the interview that except for the INGOs leading the grant, we rarely meet the donor. Most of the time, everyone assumes that the INGO is the donor, but that's not the case. This is highlighting the disconnecting between local organization and donor, which can limit the effectiveness of contextualized intervention. While feedback mechanisms are already in place across many GBV programs, the challenge lays in ensuring that the feedback is not only collected, but also acted upon. WLOs, WROs, and clients often share valuable insight about the challenges and needs within their context, yet many report that their feedback does not translate it into a tangible change. One of the WLO representative note that feedback is collected, but it rarely leads to a change we can see. Also, one of the clients underscored the importance of taking a holistic view when meeting needs. During an NFGD, which I was there, one of the clients said that while taking into consideration the importance of to have access to a toilet, that's also very useful that we need to have access to enough food to create the need to use the toilet. Or one of them said that we need first soap, then shower. So while you're making the shower or public bathroom, there should be meeting the first need, which is the soap. So to address these, donors and INGOs must create action-oriented feedback loops, and WLOs, WROs, and clients must receive clear communication about how their feedback has been influenced program decision. And regular update and tangible adjustment based on community input should be built into program implementation cycle. In the other hand, WLOs and WROs playing a vital role in contextualizing GBV program. Yet the often lack of resources, training, autonomy needed to implement sustainable and effective intervention. Donors should fund INGOs' effort to equip these organizations with skilled tools and required to independently lead GBV programming. One of the donors emphasized this gap, stating like, it shouldn't be the case that INGOs keep mentioning they have local partners in their sub-grantees, but after years, the sub-grantee is not yet able to apply for funding independently. This observation is also underscoring the needs for a capacity building initiative that goes beyond short-term technical assistance to foster sustainable growth in self-reliance among local organizations. Also, a critical issue which was raised by WLOs and WROs is lack of empowerment and escape provided by INGOs. As one of them pointed out that INGOs are afraid of us taking their place. Therefore, they are not giving us space. This is reflecting the underlying tension between INGOs and local actors, where INGOs may hesitate to allow local organizations to take the leadership role and fear of losing control. The key areas that was highlighted in this report for capacity building is including strengthening the ability of WLOs and WROs to design, manage the program and align with both global standards and local realities, providing training in financial management to ensure compliance with donor requirements, and also developing advocacy and leadership skills to enable effective engagement with coordination mechanism and policy-making process. At the end, we can say that contextualization is essential for ensuring that GBV programs are effective, relevant, and sustainable in addressing unique needs of clients in diverse settings. While global standards for GBV prevention and response provide valuable guidance, the effective implementation of these frameworks requires significant adaptation to local, cultural, social, and legal realities. Local organizations, specifically WLOs and WROs, play a critical role in contextualization process, but they face significant funding, capacity, and coordination barriers. Donors are increasingly recognizing the importance of contextualization, but existing funding mechanisms remain rigid, often prioritizing short-term output over the long-term flexibility required for contextual adaptation. The finding of this report has have important implication for both practice and policy. For practitioner, contextualization must be integrated into design, implementation, and evaluation of GBV programs. Local actors, including WLOs and WROs, should be given greater control over program design and resource allocation, with flexible funding that enable them to respond to the needs. And also for policymakers, governments, and international organizations, they should prioritize long-term and flexible funding for local organization with a focus on capacity building to ensure that the local actors can lead contextualized intervention. And also new policies should recognize the need for adaptability in GBV program, ensuring that the global standards can be implemented effectively in different cultural and legal contexts. And at the end, in practice, donors, NGOs, local organizations should strengthen feedback mechanism to ensure that the programs remain responsive to clients' need. Donors and implementers should work closely together with local stakeholders to ensure contextualized in relevant and cultural sensitivity. You can have access to the full report in 5 languages, including English, Spanish, Arabic, Swahili, and French in GBV Responder webpage, and I can share the link here. And again, this is the continuation of the IRC effort for highlighting the role of our local partners in having an effective and efficient GBV program for our clients. So I'm happy to take any questions, thoughts on that, if any. Thank you so much for your time. And I was trying to be very short considering the time that was allocated for me.
Sorry.
I'm sorry if I went beyond
No,
that.
but we definitely want to take some time for questions. I saw Christine in the chat was saying interesting. It's about power play, right? I mean, a lot of the conclusions that you bring are similar to the questions around the coordination, right? And how we talk about engaging communities, but are we able to adapt to what we hear, and are we ready to change? And the power dynamics between international NGOs and local organizations, between the donors and the local actors, and the UN and the local actors, and the local actors being those being the first responders. I thought it was very clear, but questions? This is your chance, everyone. How many countries did you do the gather the information from, do the analysis from?
So we did it from Guatemala. Like we were trying to maintain the regional diversity. So we went to Guatemala on behalf of Latin America,
Okay.
and DRC from Africa, and Jordan from MENA region. And it was also more like how we have this facility to have face-to-face conversation with our clients. Like most of the countries were good to have, but sometimes it's very difficult to have those FGDs directly with our clients or reflective in their region. So that was the most convenient countries that we were able to reach out to them.
And it was mainly the WLOs and WROs working with IRC as implementing partners, like using your own networks, or did you go beyond? And then I see Christine has raised her hand. So maybe you want to take a question from Christine first. Christine Appio, over to you.
Thank you, and apologies I joined late. I was involved in some strategic plan discussion. Very interesting presentation, Faiza. as I'm just reflecting to the conversations that we had during the GBV AoR core members meeting, where there seems to have been, a lot of questions around, who do we, how do we engage beyond the formally recognized women-led organization, women's rights organizations? And I'm just imagining if in the next few years, considering, okay, INGOs see the space and shift, are we actually gonna create some sort of, structures, organizations that probably look pretty much also as the INGO structures? And then how would that, the implications in terms of other, like the younger and sort of non-formally established women-led and women's rights organizations. But also the other question that came out a lot during the time I was with the AoR in the field was, the question around GBV actors or NGOs or UN working with the same women-led organization, women's rights organizations over and over again. So at what point do you actually say, and I'm wondering whether this came up, that, okay, we have enhanced the capacity of these women-led organizations and now we're going to sort of win them off and then, focus on bringing up or supporting other emerging, the women organizations that might be, struggling. I'm also wondering whether there was any conversation around how the well-established women WLOs, could actually support, some of the emerging WLOs. Over.
Thank you so much, Christine. And I'm coming to you, Astrid, and then to Christine. We were trying to gather, having this KII and having the FGDs, both IRC's partner and also who are not our partners. So it was like very wise, and whoever was available, and they were providing, they were actively working in this area. And about your insight, Christine, I would say when I was in DRC, there wasn't like we were going through the very well-established WLOs, but also they were guiding us to go to community-based organizations that was not like established or registered or something like very for organized one, but they were actively engaging in the supporting survivors and women and girls in their community. So that was when you go through these findings and things, this is the reflection of them there, that really what they're saying, like donors are coming or INGs who are leading the sub-grantees are coming to them and asking for the needs of the survivors or the needs of women and girls. And then when they are giving their like analysis or the draft that what are the needs area, but then it goes and it disappears at some point. Or at some point, these are very short term or the funding is very limited that is in a state of being beneficial for the women and girls. It's causing some of the time harm, like and also it's getting in practice for their dignity. For example, there's lots of toilets, but there's no saw, so it means that their need is really not considered. Like one part is highlighted in the other part, which was bring it up and it was both by community-based organization, women and girls was either not considered or either was like I don't want to say, but kind of ignored from the decision making.
Thank you, Faiza. I'm looking if there are more comments, and maybe it's true we also had more discussions about how to increase the representation of women-led organizations working at country level in the global AoR. And then I think, well, we have to, and then the whole kind of restructuring of the governance, because it relates, right? It's also about power, who's part of the global, has kind of been halted or stopped a bit while we're because now everything is floating. So now we're trying to understand the broader structure. What will coordination? What will be the humanitarian coordination, and how will, you know, the priorities of women and girls in GBV be set within that? And so we haven't had as much time to think about our global governance just now. So we just settle, and then we can continue if it's still relevant with that discussion. With that, I'd like to hand over to Bidita. I mean, I know Akiko is also on our call, the global coordinator. I'm sure she's been very much part of this work as well on the voices, but I think today it's Bidita presenting. And again, maybe just to say, we've had voices reports. It started in the whole of Syria. We've had in Somalia, I think Sudan, in Cameroon. So it's a methodology that UNFPA has promoted in different countries. As the AoR, we've been very interested in promoting it as well, but we felt our priority in the end had to be around kind of coordination, information management, more directly around results and monitoring, etc. So it's a collaboration, and over to you, Bidita. We have like 20 minutes.
Thank you, Astrid. Please let me know if you can hear me. I can also
Loud and
close
clear.
my video. Okay, great. Good to know. So colleagues, I will go over the slides a bit quickly because of the time, but I do welcome some time at the end so that I can take your questions. Next slide, please. So as Astrid mentioned, this Voices comes from a rich tradition of this approach that has been tested and implemented in various contexts. And in Ukraine, we piloted it last year. As you may know, this is an in-depth GBV qualitative study, generally done through focus group discussions, and it basically listens to, centers around, and amplifies the voices of women and girls. So I will show you some direct quotes that we have from women and girls from Ukraine. Obviously, they have been translated into English. Our main focus for this year, where we piloted this initiative, was focusing on the types and risks of violence as perceived by the people of Ukraine, the availability and barriers for survivors to access GBV services, as well as barriers to access humanitarian assistance safely. Next slide, please. Without going into too much details, I just wanted to highlight that, you know, we this year tried to focus on women and girls, as well as older population and men and boys. One of the things we also did was we looked at collective sites where many IDPs are located. We also included women and girls with disability with their caregivers, as well as Roma women and girls and people from the LGBTQI+ community. In addition, we also had FGDs with GBV experts, and this was grounded with an analysis of secondary data, which was available at the time. Next slide, please. For this year, one of the things that we tried to do was we tried to not only focus on the areas which are near the front lines. As you may know, in Ukraine, the front line for the war is in the east and north, as well as part of the south of the country. But for this, what we did was we took two regions which are near the front line and two which are away from the front line in the west and central region. And out of this 4 region, we then focused on on 7 smaller sub-regions, which are called Ramada in Ukraine, and in total 49 focus group discussions were conducted. I just want to briefly talk about some of the achievements for Ukraine. One of the things which is a first for voices globally is that we were able to do consultations with LGBTQI plus persons. So this is a first for the voices. In addition, we also engaged the GBV AoR hubs at the regional and oblast level. We were also able to train partners in voices data collection approaches and tools. More than 40 people were trained. And this is significant because this is one of the first research with participatory approach that has been conducted in Ukraine. We, of course, integrated this with the HNRP 2025 process. We included findings from this in the narrative part. We have also included some indicators, which I will talk about in a minute. In addition, we integrated it into the 16 days of activism, other events such as the Kharkiv GBV Forum, and we tried to ensure that there was interest generated among humanitarian and GBV platforms and leaderships, as well as donors at both national and global levels. Going forward, can we go to the next slide? Here you see 2 quotes directly from women from Ukraine. And as you can see, there was a lot of appreciation for this research because many felt that this was the first time that they were given an opportunity to speak for themselves. Next slide, please. In addition, we now have both the Voices report, which is an in-depth report, which looks at all the findings and then includes recommendations. And this is mainly oriented towards humanitarian practitioners. Next slide, please. As well as an advocacy brief, which is an abbreviated summarization of the main findings and recommendations, and is mainly aimed towards high-level advocacy. I will, of course, include the link to the presentation. Oh, Akiko has already included. Thank you, Akiko. But I've also included QR code so that you can scan and you will be taken to our GBV AoR page where you will be able to access both the advocacy brief and the report. Next slide, please. So how do we ask people to use these 2 resources? First of all, we have the quotes, which you will, as you have seen, are cited by the respondent profile and by the region or oblast, as we call them here in Ukraine. Of course, other than this is not for the LGBTQI plus people to protect their anonymity. But other than that, you will be able to find that. If you're doing any research or anywhere where you want to use it, we recommend that this should not be used as a standalone code, but please use them in the context in which they were presented in the report. So we have been using it actually for humanitarian response planning. We are also encouraging other clusters to have a look and use it as needed. We also are encouraging, and we have also presented this at the different OCHA-led assessment-based working groups so that others who are doing assessment can use it. We hope that this can be used for project design and for proposals, as well as curriculum, IEC materials, etc. And similarly for advocacy messages and communications, if there is any interest, please do get in touch with us, and we can also share with you some of the other products that we have for advocacy, which are based on these reports. Next slide, please. So let me now very briefly go over the findings from this report. So as you will see, there are many things that we have put in the slides here. And basically, these are some of the factors which are noted and prioritized by the women and girls, as well as other people who were asked these questions. So going from electricity cuts and lack of public lighting, this was especially true for last year when there was a lot of electricity cuts in the country, to we found out that particularly in the rural areas, there was a lack of understanding about GBV and awareness about what are harmful gender and social norms. We also found out that the reduction in humanitarian assistance was having an impact. Last year, we were slowly focusing more on the areas which are near the front line rather than in the western part. And we saw in this report as well. In addition to this, we also found out about changing gender roles, the impact on the crisis on masculinity brought about by the war. The economic crisis was noted again and again, as well as for the IDPs' crowded and poor conditions in collective living. And also something that we found out was there is a very strong perception that there is a lack of accountability for perpetrators. Next slide, please. But again, I wanted to emphasize that the conditions for GBV and the risk of GBV were present before the war, but from what we got from this, which we already knew anecdotally, of course, was that even though there were problems, but the war has made the situation more complex and worse. Next slide, please. This is very briefly like some of the things that I wanted to highlight as resources that you can go into. I don't have time now, but something that I want to show you are the variety of places that that women and girls mentioned where they feel unsafe. This ranges from home, where because of the war and the different situations here, women and girls are feeling increasingly unsafe, and there are reports of intimate partner violence and domestic violence. So going from home to streets, workplace, etc., all these locations were noted as places where they feel unsafe, including online or virtual spaces where women and girls reported technology-facilitated GBV. Next slide, please. These are the different groups who mentioned that they were facing heightened risk of GBV and barriers when accessing GBV and humanitarian assistance. Particularly in the list are displaced women and girls, such as the IDPs and returnees, and especially those who are residing in collective sites or temporarily at transit sites, as well as adolescents, older women, women and girls with disability and their caregivers, Roma women and girls, those who are HIV positive, and LGBTQI+ persons. Also, in the focus group discussions with men and boys, it was found that male survivors often also face barriers to accessing GBV services. Next slide, please. So these are some of the common strategies. So, we found that actually the most common strategy is that the survivors just stay silent. They avoid and try to de-escalate the situation. And there are many reasons for staying silent, but one of the two main reasons which were highlighted were shame, stigma, and customs, as well as victim blaming. And there were also other strategies used, such as seeking support from others, self-care, and the less common strategies were unfortunately speaking out about violence, reporting, and/or seeking services. So this is something which we found from this study, where seeking services was less common than staying silent. The next slide, please. So before we go forward, I just wanted to briefly talk about the services and programming for 2024, where we have focused on increasing awareness and the different services that you see here. Going forward, next slide, please. We also recognize that many people still face a lot of barriers. Now, for women and girls of different ages and at different sites, such as rural and urban, it will obviously differ. But what you see on the slide are some of the different challenges that women and girls are facing. And we took this into consideration when we were updating our HNRP for 2025, particularly the activities that we included. So one of the things that we found from here was challenges in accessing referrals. And therefore, for this year, we have included referrals as one of the activities that we are tracking to see how referrals are going on. Also, we found out that confidentiality and quality of services are issues. So we are working to ensure that we can work with partners to improve the quality and also to ensure safety and confidentiality of all information. Next slide, please. I also wanted to show this particular page to highlight that like women, girls, and they face different kind of challenges, and of course the challenges will differ by their age, by their status of having the registration information, if they have it or not, etc. But there are multiple different challenges that people face when trying to access humanitarian assistance, which can be just having no electricity, to having no time to access these different services and assistance provided, to not having the trust in public institutions and authorities and fears about confidentiality, or not being able to provide feedback. So there are multiple challenges that they face, and I will of course share this with you so that we can go over this, and please feel free to get in touch with me. Next slide, please. So I will not read out everything, but very briefly, our main findings were that, of course, GBV has been escalating, which is fueled by the war. And as I mentioned before, home is unsafe, but so are places outside of the home. Next slide, please. These are again quotes from the women and girls. Next slide, please. We also find that there are risks of sexual and labor exploitation, trafficking, and technology-facilitated GBV. These are growing because of the deepening vulnerabilities of women and girls and other marginalized groups. Conflict-related sexual violence remains a grave concern for women and girls, particularly in the frontline areas. These risk factors that we mentioned, these are actually growing, and they are compounded. So they are heightening stress and aggression, and sometimes also contributing to rising substance abuse within the communities. Coping mechanism for women and girls, the positive ones are slowly diminishing due to the deteriorating economic conditions. And survivors often face deep barriers to report violence and safely access GBV services. Next slide, please. Again, these are some quotes from the different participants in the study. And we also found that particularly in the rural areas, there is a limited awareness about GBV and that people can get different services. That's something that we are working on. And women and girls and other marginalized groups, including the LGBTQI+, also face different kind of barriers, including severe risk of violence and there are growing risk now of SEA as well as different scams. I have some recommendations as well, but just to keep some time for questions, maybe I will ask that we go to the last slide. So we have some recommendations and I will share this with you so that you have them. We put some recommendations for GBV actors as well as humanitarian actors, which I haven't included here, but happy to share. We have some for coordination, policy, and advocacy as well. But the last thing I wanted to do is to leave you with the hopes and dreams of women and girls, which we asked during the study. And these are some of the hopes and dreams that were shared with me. This is from the report, which you can also read. And lastly, let me share the last page. If we can go forward, Shiva. And yeah, again, like you can scan this QR code and read the report as well as the advocacy brief. And a huge thank you to everyone who were involved, particularly Olivia, who led the initiative, as well as Maria and Anush from UN FBA, and Akiko, please correct me if I'm forgetting anything. And of course, all our team members, including our field colleagues. So detailed acknowledgement are included, but yeah, I think I will stop here. Akiko, please let me know if you want to mention anything.
Thank you so much, Bidita. It was an excellent presentation. I don't have anything from my end because she did such an excellent presentation. Just two things that I wanted to mention. So this report, I mean, the Ukraine response is really large-scale response, and better funded than the context. So you might think that programs are less. There are less problems, with the operation, but with the GBV response. But it's very, very complex, because of the issue itself. The GBV is very, very politicized, and then it's not really easy, to talk about these deeply politicized issue. Particularly beneficiaries are not really it's very difficult for them to speak up about these issues. So this really gave opportunity to openly talk about these issues that are not often spoken. Oftentimes they the issues that are highlighted about in Ukraine response is maybe CRSV, perpetrators of often Russian soldiers, or certain types of GBBs, but it's much more complex than that. And then there are certain impunities for certain types of perpetrators, because it's very, very politicized. So I think it was really great opportunity for us to have all these voices together in this report, so that we can really present that how complex the issue is, and we really need to continue to address this issue, even though it's not really easy to address in the politicized context. Another thing is that the voices, what we heard from the respondents was, some of them, for some of them, that was the first time to be consulted, and they really want to be heard more. So just to highlight that, GBV AoR's approach on engaging women-led organizations is extremely, extremely important, because they are often pathways to connect us together to the voices of women and girls, on the ground, for, improving our response. So that was really the key takeaway, that I learned from this report and the process, that, we really need to hear more from them, and we really need to continue to hear from them continuously. Thank you so much.
Thank you, Bidita and Akiko. I'm afraid it is already 5. I think what's amazing with these Voices reports is always it gives such rich information, and I know it's a massive undertaking in terms of the amount of focus group discussions, the amount of meetings that have been set up, the training of everyone gathering data and managing focus group discussions. So a huge applause to you as well as to Faiza, who did the earlier presentation. I don't know, are there questions? Very happy to have a few questions and for Bidita on the Voices. I also recognize the time, but I'm happy to stay on at least. I don't know. I'm going through the tablet. I don't see any questions. So I guess with that, you've received the links, right, to the report on the women-led and women rights organizations and how they're contextualizing and the power dynamics and the rhetoric versus practice on local GBV responders in humanitarian crisis. The link was shared. I'm sure we will also share the link again when we share in a follow-up email with Chiva. You've also seen the link to the Ukraine report. It will also be online. We'll share the link. So I hope you will read, enjoy, and you can also then send your applause or questions to Bidita or Faiza in the next days and weeks. I'm sure they'll be happy to hear from you. So with that, I think, yeah, is there an urgent AOB? This is your opportunity. If you have something that you would like to raise for everyone or an urgent question. No? No? Okay, then I'm going to close the call. Thank you so much, everyone. Thank you to our team. And next time, I am sure Jennifer will be online and talk to you with Esmeralda, the new coordinator in Sudan, about the mission there with Pep, who's online, the Global Protection Coordinator, and Ron, the Global Child Protection Coordinator. So thank you, everyone, and have a lovely evening as much as you can, and stay strong. We know this is a time with a lot of changes, and it's impacting our partners, our friends, our colleagues, and ourselves. So stay strong, and yeah, see you soon. Bye.
Bye.